Okay, everyone, welcome to the video. We have today with us Angie Nichols. Welcome, Angie.
Thank you.
Maybe you introduce the lady next to you.
Okay, sure. I would be happy to. So we have Elaine Alder joining us. She has been working with Tier 1 and helping compound prescriptions for our patients for about the last 8 years. And so I talk with Elaine almost every day. And I'll just let her tell a little bit maybe about her background.
Welcome to this channel. I am Dr. Steven de Vos, the lifting dermatologist, and this is my bro science hunting partner Danny Bossa. If you want to learn more about the most cutting-edge science-based information in the world of hormone optimization, please like and subscribe.
Click the bell button to get notified.
I also invite you to join my other YouTube channel, The Lifting Dermatologist. The link you can find in the description of this video.
Hello everyone. I've been in the compounding business for about 30 years almost. I find it very enjoyable. Used to years ago in a pharmacy, you would have a doctor, a pharmacist. He would mix things together to make medications for a patient, and started doing some of that with a pharmacist, and just thoroughly enjoyed that. My background is I've been in pharmacy a long time, and I am a certified pharmacy technician. I can work in any of the 50 states. If I choose to work in a different state at the time, I do need to register with that state. But it's just a great opportunity to help people to change their life and meet the needs.
Okay. The first question that comes up is, can doctors or clinics and pharmacies have this kind of relationship in your state or in the United States? Because, I'm a dermatologist and all doctors in Belgium, we cannot work together with a certain pharmacy. We are even forbidden to refer a patient to a certain pharmacy because it's the patient's choice. It must be open. That's our law. So we cannot have any relationship. In the past, there were couples, the man doctor, the women pharmacy, and they were next to each other or in the same building. And that's even forbidden now. You cannot be in the same building as a pharmacy. So how is the law about that in the United States?
Well, the law is very similar. However, a physician can recommend a patient to get his prescriptions at a preferred pharmacy, and usually there's reasons for that. Is because a pharmacy does quality product, they offer competitive pricing, and they do testing on their products, especially in compounding areas, because not everybody compounds the same way. It's just like when you bake something, not everybody bakes the same way. Compounding, you need to know where you're getting your prescriptions filled, and then it's a quality product. Pricing is important, but quality is the best option by far. I will tell you how we found Elaine. So when we first started the practice, we would let patients go to any pharmacy that they chose. And they still have that option. We let them go, but we explained to them the reasons behind the pharmacies that we use. So anyway, when we first started, we would see levels that were just inconsistent all over the place. There was just no way we could predict, because consistency from pharmacy to pharmacy varied. So we started trying to figure out a way that we could control that a little bit. And so I went down the list of every pharmacy in the state of Tennessee that was PCAB accredited, and was trying to find someone that we felt comfortable with, referring our patients to, and also that could provide competitive prices. So there was 6 or 7 in the state, I can't remember at that time, and Elaine's pharmacy that I had contacted was the very last one on the list. But whenever I spoke with Elaine, I knew immediately, after talking to her for maybe 5 minutes, that this is someone that we wanted to do business. We had the same philosophy. We just wanted to provide really great products and give great service to the patients. So over time, we've developed a great relationship, and that's just how it all began. So
I know in Belgium as well, for me personally, I write a lot of prescriptions for compounded creams, especially cortisone creams, tar creams. things like that for dermatological diseases, of course. And I have seen several patients come back to me with their jars or tubes of cream, and they differ indeed a lot from one pharmacy to the other. And I always explain to patients that's like making mayonnaise, because a lot of people like mayonnaise in Belgium. So one can do it and the other one can't at all. It's not mixed as it should, or there's water on top of the cream or whatever. So are there big differences in compounding hormonal preparations as well?
There is. You have to have consistent and thorough products. You have to have just training. Training is a big thing. Taking pride in your work, following the formulation specifically is very important, because if you get a step out of it, then you may not have a quality product. And that sounds like what's happening. Sometimes they can be gritty. That means they have not been, properly milled. It can happen. And the expiration date. You need to be careful about that too. Not everything's good forever. There is some things that if it's mixed with the water, it's only good for 14 to 30 days.
Isn't there a kind of quality control from higher instances?
It is. When you put a formula in, you always have a pharmacist to verify, to check it. You always want to have a good resource, especially when you've had some training done, you have access to formulations, to different ones at work. It's always a standard of operations and procedures that you follow when making any type of a compound.
Mm-hmm. Okay. Are there big differences between over-the-counter supplements, like I think DHEA or pregnenolone? I know in the United States some of those are over-the-counter. What's the difference with compounded capsules, for example?
Well, when you're getting a compounded like a DHEA or melatonin or pregnenolone, any of those type of things, you're getting pure form. You're not getting any additives or anything like that. Most of the time, it might have a slow-release agent, which is methicillin. That's a slow-release agent that we use in compounding, and each capsule is packed and weighed at the end of making that formula or that log of that prescription. And there is a difference between over-the-counter and compounded, because over-the-counter you're getting a food grade. It might contain, some of that main ingredient, DHEA or pregnenolone melatonin, but it also has other things in it too, like binders and fillers. And, you're not sure how much you are getting, because a lot of those products are not tested by the FDA. Ours are. They're tested for potency, and they're weighed and packed specifically for that formulation. So that's why the melatonin 3 milligram over the counter is not going to be nowhere near as strong as melatonin compounded. And you do have to have a prescription for anything that's compounded.
Mm-hmm. Okay, that's clear. So let's maybe talk about those progesterone troches, Angie, that you recommended for my wife. So I made a prescription myself, and I asked my pharmacist, where I always work together with, or I cannot work together with anyone, but I ordered there my preparations, so I trust them a lot. And he even never heard of Troches. So that's the Belgian situation. So I ordered them in a compounding pharmacy in Greece, where I have ordered testosterone cream before as well. What's the purpose of them?
Well, progesterone troches, they're used sublingually under the tongue, and we make a lot of other things in a troche formulation as well. If you bypass the liver and the GI tract, you get the full, as much absorption as you can that way. They are a great product, progesterone troches are.
They raise blood levels much better than a capsule form. They're not the most pleasant tasting things, but Elaine can try different formulas for different patients if they have trouble tolerating it. She has a cherry flavor. She has something called orange creamsicle, vanilla butternut. There's different things that they can do. Which, interestingly, we have pets, so they can even make prescriptions for your pets to make the tablets more palatable or something like that, like maybe turkey flavor or something like that. So compounding gives you a lot of flexibility. One patient may not tolerate a certain formulation, and they can't tolerate it in a different form.
I like metformin. Metformin sometimes is really hard to tolerate and causes a lot of gastric trouble, and we make a topical cream for that.
Mm-hmm.
They get the benefit without the side effects.
Mm-hmm. Those Troches, they look to me like they were melted before and then they got hard. So how are they made exactly?
Well, what we do, we have a mold that is made out of titanium, and it is sprayed down with a coating that keeps it from sticking. And then we melt the base, add the active, which would be progesterone, and then we pour it into that mold and let it dry and harden, and then we just pump them out. And it's a much better form. You can get troches in a compact, and those are hard to get out, and sometimes it depends on the base. We use a specific base that we've designed ourselves, and it stays away from a gelatin base, which is very hard, sticky. It gets hot. It takes about 20 minutes. Ours takes about 4 minutes to dissolve. And then we even have one that's smaller that's called a mini troche that looks just flat on one side and round on the other. It's very, very small, and it melts in 2 minutes.
Mm-hmm.
And I've seen lots of different troches because, again, whenever we had patients come or take their prescriptions to different pharmacies, they would sometimes bring them into the office and show me what they had, and they would be melted or they would be uneven, and it really is like Elaine said about, some cooks are better than others. You may follow the same recipe, but I think a lot of it comes to practice. You have a lot of experience doing it, then you can perfect it. Even though you may be following the same recipe, you get a different outcome. So that's another reason you just want to make sure you get a pharmacy that is, well-versed in compounding and has a lot of experience. If they do more volume, they're going to probably be better at it. And so, you want to make sure that you get that. So how does she tolerate the troche? Has she had them yet?
Has she?
Does it bother her?
Well, the first days she found they were a bit irritating against the cheek, and they take a long time to dissolve, 45 to 60 minutes.
Oh, no. Yeah, it shouldn't be that way. Elaine's takes 4 minutes. I timed it once, and it was literally 4 minutes. But she can move it around under her tongue to get it to dissolve faster. But, they will in the summertime, because here in Tennessee, it's hot, humid temperatures. So they'll send it in a cold pack so that it doesn't melt in the mail. But once you get it home, you can just keep it at room temperature. You don't have to keep it in the refrigerator, because if you do keep it in the refrigerator, it will take longer to dissolve. So room temperature is good.
Okay. I'll share those tips with her.
Yeah.
Cut it in half if she can. Do a little bit at a time if she needed to.
They may want to try a different base or something if it takes that long to dissolve. Maybe a little adjusting there. I'm not sure. Okay. It shouldn't take that long. No.
It says on the package, wait 15 minutes before eating or drinking after it has dissolved. But then that takes 1 hour and 15 minutes.
Yeah. Well, she needs to get it all absorbed she can if it's taking that long. Yeah.
Okay.
Does it have a waxy texture, sort of, or a gelatin?
Yeah.
What texture does it? Have you felt them, or?
I'll maybe get them and show you. Just a minute. Just a minute.
Okay, that's fine.
Take a chair.
Yeah.
So now we're two as well.
Hello.
It's nice to meet you.
Nice to meet you.
Very good. I see the compact.
That's awful. We had those years ago, and that's when they first started making troches. They had those compacts. It's just a sleeve. Yeah.
Let's see what it looks like inside.
Yes.
Oh,
they're red. Or
they put food coloring in there.
Wow.
and they're smelling nice,
Like candy?
like candy. Yes.
Yeah, this is what these look like.
Dangerous if your children find it, I guess.
Let's see. Here's what they look like. Can you see that? It's a little round, waxy disc kind of thing. It's about the size of a dime, and but there's no coloring. But
They seem very waxy as well.
Yes. And
yeah,
and the,
actually, this is kind of feels dry, but when they get warm, they're a little sticky. But this one actually feels dry, but it dissolves in like 4 minutes. Very quick.
4 minutes.
yeah, but
Vertel me.
I can take them in my mouth for an hour. But yesterday I had another tactic. I put it under my tongue,
That's the best way.
Yes.
and that was half an hour then.
Okay, yeah. If you move it around, like roll it around under your tongue, kind of like candy, the friction will help it to dissolve. So I would
Yes.
try that.
Yeah.
We've actually had some women say they just can't tolerate the taste, and we've tried different things. And you can actually insert them as like a vaginal suppository too.
Mm.
The level's not quite as much absorption, but you can test them and see. It's an option. Sometimes we have to get creative.
Yes.
Be careful with that because that food coloring, if you're not careful, over a while it'll stain your teeth.
You can ask them to leave that coloring out.
Right.
It shouldn't be included in the base, should it? That's
I have
it.
never looked in my mouth. I always do it in the evening, and then I brush my teeth and I go to my bed, and I've never looked in my mouth really.
Yeah.
Tell me afterwards.
Yes, I'll have a look.
I think you'll probably leave that out.
It's hard for them to keep that color consistent. They're going to use a drop, and that's hard to measure sometimes. I tell them.
They do look pretty though.
Yeah, they do. Are they smooth on top?
Smooth.
Are they smooth? Compact on the top? They should be smooth, even all the way
Yes.
across. Okay.
Very waxy.
Yeah.
Waxy, yeah. Is it? Yeah. And in the end, it's like a sort of how do you say that? Like so korreltjes. It's like yeah.
A bit grainy like in the
Yes.
end.
That's the progesterone. Progesterone's a bitter tasting drug too, as well, and it's hard to mask that. I use about 1% of my base is my flavor.
Mm.
Okay. Any more questions for us?
I don't know. Can't think of anything. Give it a good month, and then we'll see where levels are, and then kind of go from there. Can you tell any change when you take the progesterone? Does it make you sleepy or?
Well, I sleep better at night.
Yeah.
Yeah, I'm very glad since I do it. I have better nights, and that's very important for me because I feel better during the day because I sleep better.
Sure.
And in general, I feel better.
Good. Very good.
Thank you. And I only have a 2/3 now. This evening I have to start with testosterone.
Yes.
Yeah.
Okay. Very good.
Yeah.
Okay, so thank you so much for all the help and the explanation. So maybe one last question for Elaine. What's the importance of the good relationship between the doctor and the pharmacy working together?
Well, you get better patient outcome when you work together with a physician, and not only that, I mean, you help the physician. My job is to make sure that the physician looks good, and if this patient is doing well and gets a quality product, they're going to come back. They're going to come back to the pharmacy, and they're going to go back to that physician, and that's important. You know, you want to do something that's going to better somebody, to help them through life, change their life. And hormones can. If those hormones are out of balance, it affects every aspect of their life. And that's why we try to do our best to do a quality product.
Mm-hmm. Do you make all the compounding, also the creams as well, the testosterone cream?
Yes, sir. We did. Yes.
Mm-hmm. Is there any regulation in the percentage of the testosterone cream you can prepare? Because there is in Belgium.
No, only thing is you have to worry about, most you can supply at one time to anybody is a 6-month supply. That's a federal guideline. And you just have to make sure you make a quality product.
Mm-hmm. Because here in Belgium, there's an upper limit of 2.5% in the cream for women or men even.
It's not, about the most you can get effectively into a gram of cream is about 20%, and that's equivalent to 200 milligrams. Above that, you're going to be making glue or paste, and it's going to leave a residue, and the patient's really going to be wasting money. They're charged more for that because it's a stronger testosterone, and they just don't get good quality product. You don't want to harm anybody.
Yeah, of course. And the funny thing is, here in Belgium, we can prescribe whatever percentage we want. So I can prescribe 20% testosterone, even 30. Even I know it isn't doable or whatever, but the prescriptions are okay for the law, but the pharmacy is forbidden to prepare more than 2.5%. So I can go and get internationally my medication. So I order in Greece and they send it. I have it in 2 days here. So that's a funny thing. The doctor isn't forbidden, but the pharmacy is.
We've been told that from multiple compounders that if they put more than 200 milligrams per gram in the testosterone, that it will crystallize. And we saw that when we first started as well. Some pharmacies, patients would come back and say, yeah, they didn't like it. It was gritty. And levels also didn't come up when it got like that. So again, I think it goes back to the skill of the compounder, just making sure, like she said, that it was milled properly. And I think probably the equipment probably has a lot to do with it as well, making sure you have the right equipment. And that was a question I had for Elaine. Like for most patients, how do they know? How can they ensure that they're getting the potency of what the pharmacy is, promoting or saying that they're getting? How do they know that they're getting a quality product?
That's good. That's a good question. We follow up with testing with ours. We do an initial testing. Which will be at the onset of the testing facility receiving the product, and then we do a 30-day, we do a 60-day, 90-day, and it depends on the product. We'll even take it out further up to 6 months. That way it's tested and it has quality assurance. You need to check, if you're going to use a compounding pharmacy, you need to check with their state board, make sure that they're in good compliance. Compliance with DEA. Sometimes you can ask the compounding pharmacy. Sometimes they're easily promoted, that they have the affiliation with a lot of the compounding standards, like USP. They're following USP 795, which is a non-sterile compounding regulation board. There goes a lot into it to compounding, and a compounder that does it right is well worth it.
Do all compounding pharmacies have to meet those guides?
They should. Not all of them do it. Some of them won't do testing. They don't want to spend the money.
So it's not required by the government or any governing agency?
No, it's not.
There isn't the required third-party testing that has to check on the pharmacy.
Is it required in Belgium?
I have no idea.
Yeah, it's not in the States. Only thing that's required as a state board of pharmacy is to inspect the pharmacy to make sure they're following the guidelines and regulations set out by the state board of pharmacy, and those vary from state to state.
And that's what Dr. Nichols recommends too to our patients. We could do a challenge and see how long it takes yours, and I'll see how long it takes mine. I saw you just had yours. We'll see.
I already know that's not a fair challenge.
Oh, let's see. Where was I?
Talk about regulations.
I totally lost it.
And the base too. When you talk about hormone replacement creams like testosterone stuff, the base is important too. Some people prefer a gel base. They think it works faster. Not always. Sometimes it leaves a residue. We have a hormone replacement base that we use that is designed specifically for us. It's designed to carry hormone replacement. Not all those gels or bases are designed for hormone replacement therapy.
Yeah.
You know, compounding is an art form, really. I mean, you're making a prescription for a specific person, for a specific need. You know, you can make stuff for vets. You can make stuff for dermatology. I made a cream we did not too long ago for a lady that was like 36 years old. She had breast cancer, and we made a radiation burn cream for her that helped her heal that area that had been radiated. Autistic children. Makes a lot of times you can't get them to take medicine, and we'll make a gel base that's for them. We have one for nausea and vomiting. We take promethazine and make it into a gel, and they apply it to the inner wrist. That helps. That's very good, especially when you have a small child or a lady that is experiencing morning sickness. You don't get the side effects like the drowsiness and things. There's just a lot of different things. We make mouthwashes. There's hundreds and hundreds of formulations of magic mouthwashes. We do suppositories. Testosterone Troches for men, an alternative to Cialis. There's a lot of different things that we make all day long.
Are there certain formulations for, like compounding formulations for creams or troches or whatever that are standard, or can a doctor invent whatever formula he wants? I ask that because in the dermatology, I can invent whatever formula I want. I can ask for 20% coal tar, 0.1% clobetasol propionate. I can add 2% ureum, 5%. I can make whatever formulation I want. And sometimes I have a pharmacy calling me and saying, well, that's very difficult for us to make. We just can't prepare it. It's physically not doable. The same question for you. Are there standard things, or do you have doctors that invent sometimes formulas for you?
We do have doctors sometimes invent things. There's a lot of ones I've done over the years. One of them, we used to name it after him to call it his cream. You know, they make a lot of vaginal creams. We make topical creams. Yeah, you can. Now, they should be able to work with you and say, this is not doable. Because you're not trained to have to know what will go into that cream, how far that volume of that powder will go. You can always adjust that. That pharmacist should be able to work with you to help you to find a solution, because in the end, he's working for you to help you to make your practice better, make your patient well.
Yeah, sure.
My progesterone is gone.
Just chew that.
That's only a fourth.
Wow.
Wow. Yeah.
Now I do my progesterone troche at night, and what I normally do is brush my teeth and gargle with a antiseptic mouthwash, and then pump that troche in after that. That way you get as much absorbed into the bloodstream as possible. That's what I do. But yours got food coloring in them, so.
Yeah, you can do it at night because of the coloring.
Wait a little while if you can.
Is so good.
You can name the testosterone or any other cream. You can put it on there. They can come up with their own formula.
Well, they can come up with their own formula. You have to call it exactly what it is. Like if it's testosterone,
You have to put the ingredients on it.
We have to put this.
So we couldn't put a label on there with like Dr. Nichols preferred.
Yeah. We'd like to. Used to they did, and then they come across several years ago and said you can't just call it, health cream. You can't do that. Years ago, used to doctors would not want pharmacists to put the name of the drug on it. Years and years ago, I'm talking back in the late 50s probably, and then they come with new guidelines and said that you have to, and that's when they started putting names of drugs on prescriptions. Some physicians never wanted you to put it on there what it was for. If it was for, a sinus infection or, eczema, things like that. But, do it now.
Is there anything that would raise a red flag? Like that a patient should avoid compounding? Is there something that would make you
Well, inconsistency, lack of consulting with you, with the patient, would be a flag to me. Also, you know, just the lack of knowledge, because usually when your patient brings in a prescription, especially for a compound, there's going to be a series of questions that you would ask that patient. You know, do they have any allergies? You know, are they allergic to latex, anything like that? You know, because sometimes that does happen. You'll see where someone is allergic to sunflower oil, like vitamin D3. A lot of times it's encapsulated in oil. Well, they use sunflower oil to do that with, and you know, you don't want to cause any harm to a patient. So, you know, I would check if they're unsure about a compounding pharmacy. I would check with the state board or their local governing bodies to see if there's they've had a problem, and it should be on there.
And I imagine sterile compounding is even more so, that you would have to be very careful when we start talking about injectables.
Oh, yes. Yeah. When you start talking about injectables, that comes in a whole new level. There's new standards coming out into the United States. The 800 standards are coming out. Now you're having to, used to, you didn't have to separate hazardous drugs from non-hazardous. And anything that's a hormone replacement therapy is considered a hazardous drug. And that has to be in a whole different section of your pharmacy. It has to be vented to the outside. The chemicals have to be stored separately. You have to do testing on your clean rooms. All of our preparations that we do are under a hood. It has a HEPA filter in it, and we test it. We have it tested yearly. It has to be. And those guidelines are reported too. We have to show those if you make request, especially like a state board or FDA or USP.
Mm-hmm. Okay, I think we've covered all the questions I had. Anything more you wanted to add, Angie or Eileen?
No. Nice to meet you.
Yes.
Almost gone.
That's
Very good.
That's good. Well, I'd love to meet you in person. Love for you to come to Sarah Pharmacy.
Okay, so thank you so much for the explanation.
Sure, welcome. We enjoyed it. Mm-hmm.
Okay, thank you so much. And
Thank you.
see you next time.
Yeah, take care.
Bye-bye.
Bye.